morning to all of you, my leaders, in this very important event. I'm Dr. Dhlomo, the Chairperson of the Portfolio Committee of Health. I am so sorry that I cannot be with you there in Pretoria as we celebrate 80 years of the Nursing Council of South Africa, an important institution that is held by many South Africans, but even many leaders in Africa. You would recall that in 1961, when Tanganyika that is now called Tanzania, got its independence, relied on the South African nurses to come in and assist the patients there, because suddenly the white and English-speaking nurses who were in that country went back to England and left a country that was independent but under black leadership without any of the health services. Nurses from South Africa were mobilized by our ANC leaders in the leadership of Comrade Governing Mbeki and Ahmed Kathrada and many of those. That was a wonderful support that you gave our nurses and our patients in that country. Little did we know that South African Nursing Council was going to be an institution that was going to be now spreading in the whole of Africa. Today we have many countries in Africa who have nursing councils, and they learned from the way you are regulating and the way you are handling and promoting issues of nurses as a profession. We thank you very much and we commend you for this great work that you did. It is important, therefore, to reflect, among other things, that in our country, we actually were in a very ambitious program of wanting to roll out the ARV access by many citizens of our country. To date, we have over 5 million South Africans who are on treatment for ARVs. We did not rely only on doctors. We had to really have a cadre of nurses who were trained on a program called NIMAT, Nurse Initiated Management of ARTs. That program was a very, very important program that assisted us greatly into our country. And to date, that has assisted us to reduce the number of patients that are dying on AIDS-related infections. Two, it has promoted the program of PMTCT, where a majority of mothers who are HIV positive are able to give now birth to HIV negative babies, thanks to that program and to all our dedicated nurses. I should not forget that during COVID, we had a lot of sacrifices by our nurses, but with that it came in deaths. It came in some of our members who died while they were giving this support to our citizens. I commend the Nursing Council for actually erecting a wall of remembrance in Pretoria, in actually thanking those nurses and many other healthcare workers who died during their contribution into COVID pandemic. I commend you for that, and I thank you. I was actually privileged to be part of that very emotive event that we held in Pretoria, where tears of joy and tears of sorrow were actually part of us. I want to say enjoy and celebrate this 80th day, this 80th anniversary of South African Nursing Council, and we wish you many more. We are proud of you nurses. We are proud of you being the backbone of this profession. We are proud of you being the backbone of the health service delivery. Let me, in closing, indicate that today I know how to deliver a baby because I was taught in 1984 by a nurse. Nurse has got a lot of time to even prepare and train some of us as medical students to become doctors. To date, we have in the country a program called District Health Specialists. Of that program, 3 of the 7 are nurses: a pediatric nurse, a nurse with primary health care training, and a nurse with obstetric or advanced midwifery. All that we are saying has an impact in decreasing and improving the maternal outcomes of our country through this contribution. We thank you very much. Have a good day as you celebrate your 80th anniversary of South African Nursing Council being established. But maybe let me, in closing, thank those, the key, Mama Cecilia Makiwane, the first ever registered nurse in our country. 2, don't forget Professor Rachel Gumbi, the first president of South African Nursing Council after our democracy. And also remember Meredin Lehana, one of our nurses that we lost also during Ebola. May their souls rest in eternal peace. Thank you very much.